Which of the following is often cited as the single most common early but nonspecific symptom of liver stress? A. Acute jaundice. B. Chronic, unexplained fatigue. C. Hematemesis. D. Ascites. Answer: B. Chronic, unexplained fatigue. Early liver damage often affects the brain's internal clock. Which symptom reflects this? A. Total insomnia. B. Reversal of sleep-wake cycles, daytime sleepiness. C. Night terrors. D. Sleep apnea. Answer: B. Reversal of sleep-wake cycles. Brain fog or mild cognitive impairment in early liver disease is physiologically linked to A. High blood sugar. B. Inability to filter nitrogenous waste, e.g., ammonia. C. Excess vitamin A. D. Cerebral edema. Spider angiomas, spider veins, are an early sign of liver dysfunction. Where do they typically appear? A. Only on the ankles and feet. B. On the trunk, face, and arms, above the waist. C. Under the fingernails. D. In the oral mucosa. Answer: B. On the trunk, face, and arms. Palmar erythema is a common sign of chronic liver issues. What does it look like? A. White spots on the palms. B. Blotchy redness on the fleshy parts, thenar/hypothenar, of the palm. C. Blue tint to the fingertips. D. Peeling skin on the palms. Answer: B. Blotchy redness on the fleshy parts. Itching, pruritus, without an obvious rash is an early sign of liver damage. This is primarily caused by the accumulation of A. Histamine. B. Bile salts under the skin. C. Urea. D. Bilirubin. Answer: B. Bile salts. Why does liver damage lead to easy bruising even in the early stages? A. Increased red blood cell count. B. Reduced production of clotting factors, proteins. C. High blood pressure. D. Excess vitamin K. Answer: B. Reduced production of clotting factors. Terry's nails, where the nail looks white except for a narrow pink band at the tip, is a sign associated with A. Acute hepatitis A. B. Early cirrhosis/liver scarring. C. Iron overdose. D. Vitamin C deficiency. Answer: B. Early cirrhosis. A sense of fullness or a dull ache in the upper right quadrant of the abdomen typically indicates A. Gastric ulcer. B. Liver enlargement, hepatomegaly. C. Splenic rupture. D. Appendicitis. Answer: B. Liver enlargement. What change in stool color is an early warning sign of reduced bile flow? A. Bright red. B. Black and tarry. C. Pale, clay-colored, or gray. D. Greenish. Answer: C. Pale, clay-colored, or gray. Dark-colored urine, amber or Coca-Cola color, in liver disease is caused by the presence of A. Blood, hematuria. B. Excess bilirubin. C. High protein levels. D. Dehydration only. Answer: B. Excess bilirubin. Why do patients with early liver damage often experience nausea after eating fatty foods? A. The liver cannot produce enough bile to emulsify fats. B. Stomach acid is too high. C. The gallbladder is missing. D. Excess insulin. Answer: A. The liver cannot produce enough bile. In men, early liver damage can cause gynecomastia, breast tissue growth. This occurs because the liver is failing to break down A. Testosterone. B. Estrogen. C. Progesterone. D. Cortisol. Answer: B. Estrogen. Edema, swelling, in the ankles and feet in liver disease is primarily due to a drop in which protein? A. Hemoglobin. B. Albumin. C. Fibrinogen. D. Globulin. Answer: B. Albumin. Ascites refers to fluid accumulation in the A. Lungs. B. Peritoneal, abdominal, cavity. C. Pericardium. D. Joints. Answer: B. Peritoneal cavity. Fater hepaticus is a distinct sign of severe liver stress. It is characterized by A. Fruity smelling breath. B. A musty, sweet, or breath of the dead odor. C. Smelling of ammonia, urine-like. D. Garlic smelling breath. Answer: B. A musty, sweet, or breath of the dead odor. Which of the following is a common early sign involving the eyes? A. Bloodshot eyes. B. Slight yellowing of the sclera, icterus. C. Blurred vision. D. Rapid blinking. Answer: B. Slight yellowing of the sclera. Sudden weight loss and muscle wasting, sarcopenia, in liver disease is due to A. Too much exercise. B. Metabolic shift where the body breaks down muscle for energy. C. Vitamin D toxicity. D. Excessive protein intake. Answer: B. Metabolic shift where the body breaks down muscle for energy. Xanthelasma, small yellow fatty deposits around the eyelids, can be a sign of A. Primary biliary cholangitis, a type of liver disease. B. Vitamin A deficiency. C. Low cholesterol. D. Hepatitis B. Answer: A. Primary biliary cholangitis. A flapping tremor of the hands, hysterexis, is a sign of A. Simple stress. B. Hepatic encephalopathy, impending liver failure. C. Vitamin B12 deficiency. D. Iron deficiency. Answer: B. Hepatic encephalopathy.